The mountains around Stellenbosch in South Africa's Western Cape are famous for their wines. Beneath these scenic hills lies Kayamandi, a township with a high rate of HIV infection and where many live in poverty. People here who are unaware that they are living with HIV are at risk of developing tuberculosis. It was only after she had been coughing for weeks, sweating and losing weight that Martha finally sought help at the Desmond Tutu TB clinic. Here she tested positive for both TB and HIV. Although it is mostly preventable and curable, TB remains the leading cause of death among people in Africa living with HIV. A respiratory infection, spread like the common cold, it exploits an immune system weakened by HIV. Of the 33 million people who are living with HIV, only 20% know their status, and only a tiny fraction, 2% in 2007, have been screened for TB. Addressing TB and HIV as linked infections is at the heart of the approach of the Desmond Tutu TB clinic. Key to curing TB is a 6-month course of medication, but for many, the challenge is sticking to the treatment to the very end. To ensure compliance, patients at the Desmond Tutu clinic report to the centre daily to take their pills. For those that fail to arrive, the staff also do community outreach.
When they don't follow it, because we did get also those people, we are going out in the community, we look for them. Then we bring them back in the clinic, and then we explain it again when we also encourage them to take the treatment. And then after that, we give the treatment, and then they become all right.
For Martha, the clinic and the support it provides saved her life. She is now healthy enough to care for her teenage daughter.
It made me feel better because I have lost my weight and I have lost my appetite, but the time I'm using the treatment, I feel better because I'm using my treatment now. I feel better. I'm gaining now.
South Africa, the country with the highest number of people living with HIV in the world, is also grappling with one of the highest TB rates in the world. The challenge remains not only in South Africa, but around the world, to have a closer collaboration between TB and HIV services, making sure people are tested for both diseases and have universal access to the treatment they need.
No, it's not.
This is critical to getting those infected onto appropriate treatment early, which will not only reduce deaths from TB, but also prolong their lives due to HIV treatment and help to reduce the spread of TB. UNAIDS Executive Director Michelle Sidibe has made fighting TB a priority.
Making sure that today people with HIV are not dying from TB. And that's what we are calling for, not only in Kailicha, but everywhere.